Thank you for purchasing the HD Medical ViScope. Today we'll review caring for your new ViScope to ensure that you are getting the full benefits of working with this state-of-the-art stethoscope. Representing the next generation in electronic stethoscopes, only ViScope offers an integrated display with the ability to both hear as well as see a patient's heart and pulmonary sounds. This stethoscope has been designed to enable medical professionals to perform dynamic auscultation and see patients' heart sounds in real-time visual waveforms. We'll begin by turning the ViScope over and opening the battery compartment to install the rechargeable battery. Plug the battery connector into the battery socket. Now, making sure the leads are folded over, carefully place the battery into the battery compartment. Replace the battery cover, tighten the screw, and you're done. Just remember, before turning the ViScope on, be sure to let it charge for 5 hours. To charge the battery, simply connect the ViScope to a power outlet using the scope's mini USB cable and power adapter. When the battery is fully charged, we will see the battery charger indicator light change from red to green, indicating the ViScope is ready for use. And within the top ribbon of the integrated display, you'll notice the battery status is now showing a full charge. In terms of using the ViScope, a 5-hour charge will generally give you 8 hours of clinical usage. With high-definition, high-fidelity sound, ViScope's visual display creates a superior clinical diagnostic environment, displaying patients' heartbeats in the format of a classic phonocardiogram. Examples of the waveforms include a normal waveform, an aortic regurgitation waveform, a mitral regurgitation waveform, a mitral stenosis waveform, or an aortic stenosis waveform. The ViScope supports the diaphragm, bell, and a wide audio mode. HD Medical has invested over a decade refining its proprietary noise reduction technology. Cleaning the ViScope is imperative since failure to do so may transfer infections or allergies to susceptible patients. Ideally, the diaphragm should be cleaned after each use, while the body should be cleaned at the end of each day. Use only a soft, clean cloth or alcohol wipe to clean it. Don't immerse it in water or any other liquid for cleaning. Let's talk about the accessory products, beginning with the diaphragm. Under normal usage, you should rarely need to change the diaphragm. However, if needed, there are some general precautions to be aware of. Don't use any sharp tools. Do not try to twist the diaphragm off, since doing so may cause the chest piece to become misaligned or loose. We recommend using only HD Medical's diaphragm, as others can cause faulty audio and visual displays issues. Likewise, using a damaged diaphragm can also cause these same problems. We'll remove the diaphragm from the chest piece by carefully pulling it up and off the groove as shown. Putting on the new diaphragm is simple. Starting on the opposite side from where we pulled it off, we'll place the new diaphragm into the groove and over the chest piece, then carefully seat it around the groove. Your new ViScope headset is designed to be fully adjustable for your personal comfort and acoustic fit. When putting on the headset, the ear tips should point slightly forward as you insert them into your ear canal. To adjust the ear tubes, hold the spring in your hand and rotate each to the correct angle for you. Reduce the tension of the spring in the headset by holding each ear tube at the bend and gradually pulling apart until they are fully extended. To increase the tension, hold the headset where the ear tubes join the plastic tubing and squeeze until one ear tube touches the other. Repeat if necessary. When putting the ViScope away, always store in a cool, dry place. We suggest placing it on a soft surface to avoid damage in general and to the diaphragm in particular. Don't store it in a damp or hot place, as this can affect its functionality. HD Medical offers many accessories for the ViScope, including earplugs, batteries, diaphragms, battery chargers, and mini USB cables for recharging or transferring data. Please contact your sales representative or HD Medical directly at hdmedicalgroup.com for any needs you may have. Thank you for the time spent with us today. At HD Medical, we are committed to delivering higher dimensions in healthcare through exceptional diagnostic products and solutions.